appreciate you so much for making time to join us once again. We went on a little break. We are back live, the Weekend Health Talk, and today we have a special guest of honor. He's not new to us. We know him. He's a specialist physician, Kolebu Teaching Hospital. He knows what he knows. He's an expert in this field and on this topic. Please, he's a friend, he's a brother. He's very knowledgeable and he's willing to share with us freely. Please join me, welcome Dr. Daniel Amawono to share with us on the very important topic, hypertension, which is a silent killer, and about close to 10 million of people annually die of this condition and its related complication. Dr. Danny, over to you.
Thank you very much, Albert, for this opportunity to be able to share some knowledge with the public. I really appreciate it. It's always an honor. And then I will use the same method that you use. I will greet the audience, our listeners. Good afternoon, good evening, and good morning, depending on whichever time you may be listening to us. And be talking this afternoon about hypertension, a silent killer. And I believe strongly that most of us listening now or watching now, one way or the other, have heard about hypertension. It may be a relative, it may be a friend, it may be even yourself, or you probably might have heard it. You don't even know whether you have it or not, but this health condition is really, really causing havoc. And there are a lot of things about it that people really don't understand properly. And so this afternoon, we'll try as much as possible to digest this and make it very simple for everyone to understand. However, I consider this afternoon session a bit advanced for the general public, but trust me, at the end of it all, we will all be able to get a better understanding of what this hypertension is. Sorry, my slide is not moving again. So, yeah, good. All right, so this will be the outline of the presentation. We'll go through a definition, we'll go through the burden of hypertension in Ghana, the world, and then Africa as a whole. Then we'll look at some causes and risk factors of hypertension. We'll look at common symptoms of hypertension, the effect of hypertension. How do we make the diagnosis of hypertension? And how will you investigate, go about confirming the diagnosis of hypertension? And then look at management, prevention, and control, and look at some myths about hypertension. There are some things people say, is it really true or not? We'll digest all those ones this afternoon. And then we'll make a quick summary, and then thereafter probably have some question time. Right, so we'll go straight to the word, what is hypertension? When we say hypertension, what do we really mean? And to address that, I will want to start off with defining some few terms. And the first I want to define is what we call blood pressure. Whilst I think quite a number of us probably have heard about this before, and it's simply in simple terms, it is just the force that the blood that is moving through our veins, our arteries, let me put it that way, our arteries, which are tubes in our body that carry blood from the heart to all parts of the body. Now, the pressure which is exerted by this blood on the wall of this artery is what we know as the blood pressure. Okay, so it has nothing to do with the content of the blood. It's just sheer pressure, how much force is exerted on the wall. Now, if this pressure goes beyond a certain level, then we call that elevated blood pressure, or in other words, we call it hypertension. Okay, so there's so much tension on the wall, so it's hypertension. All right, so that is, in simple terms, that is what it means. Now, I brought this cartoon to explain something. Now, when you look at the heart, okay, that is beating, Albert, I guess you can see my cursor. Well, I'm not getting any feedback from Albert.
I can see your cursor. Yeah, I can see.
Okay, yeah, so this is the heart that is beating, and anytime that the heart beats or the heart squeezes blood, it pumps blood out of it through these arteries. And that blood that is pumped exerts pressure on the walls of the artery. And I've tried to zoom in on the artery over here. So this is the blood that is moving in the artery, but it's exerting pressure on the walls, and it moves along the artery like a wave. Now, this bump that you see over here, it is when the blood, the heart squeezes blood out. Okay, so it exerts some pressure on it. Now, when the heart relaxes, that pressure that is exerted on the wall is reduced to some extent, but it doesn't come to zero. And so you realize that there is the force that is exerted on the wall changes with time, or changes as the heart beats and relaxes. And so in documenting blood pressure, it is important to note this variation. And so blood pressure is usually quoted in two values, at the upper and then the lower, or two numbers, the upper and then the lower. The upper is what we call the first, or we call it the systolic blood pressure. Okay, whilst when the in between, when the heart is beating, the pressure that is exerted on the wall is what we call the diastolic blood pressure. We don't need to dwell so much on whether diastolic, there's an upper and then there's a lower. And there are two numbers, upper and lower, and all of them are important, and we need to understand that. So in simple terms, that is what blood pressure is, that is what hypertension is. Now, what is the normal blood pressure, right? Normal blood pressure. I mentioned earlier on, there are variations while the heart is beating and pumping blood through all the blood vessels. And there are variations. There's an upper and then there's a lower. There's a systolic and a diastolic. Now, because of that variation, if you look at this artery over here, there's a time where it blows out this, and then it blows out again. Now, there are times that the heart is able to, doesn't pump the same amount of blood all the time. There are variation in it. And so the pressure that is exerted on the wall differs from time to time. And so one cannot use just one time of blood pressure measurement and make that diagnosis of hypertension. There are few cases where one can really make that just by one, but under normal circumstances, you need multiple because of this variation. So normally it ranges between 100 to 30 for the systolic or for the upper. And then for the diastolic, it ranges between 60 to 80. Now, there are some who may extend it to 140, okay, from 100 to 140. There are some that may extend the lower one to 90, but there's a reason why I chose the 100 to 130 for the upper, and then 60 to 80, okay, for the lower, and it is measured in millimeters of mercury. We don't need to dwell so much on that. I think for general knowledge, these values are the important things we need to know. So this is normal blood pressure. Now, your blood pressure gets, when we say you have hypertension, when your blood pressure is equal to or more than 140 for the systolic, or equal to or more than 90 millimeters of mercury for. Now you realize that between 130 and then 140, there is a gap of, let's say, 131 to 131 to 139. And what do we call that? I mean, during the course of the presentation, we'll be able to address that as well. Now, this value that I've quoted over here, 140, there are different authorities in the world that define what, based on research, obviously, on what the cutoff should be. Now, the Americans usually have a lower cutoff for hypertension, whilst the Europeans usually have a higher cutoff. And Ghana, we are more inclined to the Europeans one guideline, and so we choose 140/90. However, there are individuals within the country where they may decide to use lower cutoff, and this is all the essence of that is to prevent damage to our organs, or prevent damage to our body. And so those individuals have a reasoning for choosing lower cutoff. So if we see somewhere that it's rating 130/80, don't be surprised about it. But this is what we are using for now. Now, in measuring the blood pressure, there are different settings under which the blood pressure can be measured. Measured in the clinic, it can be measured at home, that is home-based pressure monitoring, or some devices can be applied on your arm, where you'll be walking throughout the day, the blood pressure will be checked from time to time, and then an average will be taken. That is what you call the ambulatory pressure monitoring, right? So all those under these settings, depending on which of them is being used, the cutoff for diagnosing hypertension are a little bit different. I will not dwell so much on this for the general public, but those who want to get more understanding and more info, I think this table is good for you. Now, like I mentioned at the introduction, hypertension, I mean, it's very common. Probably every household has one person or the other having hypertension, or probably the one listening, you have hypertension, and it's a serious medical condition, okay? That significantly increases the risk of damage to our hearts, to our brain, to our kidneys, and several organs from head to toe. I mean, it can have damage to it if that hypertension is not brought under attention or is not controlled. And it is not surprising that in 2019, the WHO estimate for cause of mortality, okay, globally, I mean, identify ischemic heart disease, that is heart conditions, stroke, that is heart condition stroke, and then kidney diseases, these three as leading cause of, or among the 10 causes of death in the whole world. And it is not different in Africa, it's not different in Ghana, it is the same, okay? And these are organs that are affected. Ischemic heart is affecting your heart, the stroke is affecting your brain, the kidney, I mean, having kidney disease. And it's among the 10 causes. If you look at the 10 causes of mortality, it forms part of it. And strikingly, those that affect the heart and the brain are the number 1 and 2. And so you see that this is a very serious condition. So many people have it and they don't know about it. And it's estimated that more than 1 billion of adults aged between 30 and 79 worldwide have hypertension. And most of these people are in developing countries, or I could probably say low to middle income countries, of which Ghana is part, okay? And of those who have the hypertension, less than 50%, okay, are aware that they have the condition, or close to about 50. Maybe 50 know that they have the condition. About 50 of them, they don't know that they have the hypertension at all. Meanwhile, they are walking about because they don't have any symptoms, okay? And even of those who have the hypertension, if you take 5 of them, only one will have his or her blood pressure under control because of several factors. We go on, we will be able to unravel why this is so. And hypertension is a cause of so many premature deaths, okay, worldwide, in Africa, in Ghana. And it's not surprising nowadays you see what a shock, gone so soon. And several things, young people passing on. It could be that they have this hypertension and they are not aware about it, and it's causing this havoc of ischemic heart disease, it's causing stroke. And so it is important that we get to understand it, we get to education on it, and be able to pick it up as soon as possible. Okay. Now, one will ask, what causes hypertension? There are several causes of hypertension, and I want to put them into two categories. There is what we call essential or primary hypertension, where the real cause or how it's come about, it's not really understood. It's not properly understood. However, it's been found that it's an interplay or it's a mixture of genetic factors, what you are born with, together with your environment, things that happen within your environment. When these two interact, they may predispose you, or they may make you have hypertension, but themselves are not causes. Okay, and these environmental factors, we call them risk factors. We will address them in subsequent slide. And then we have secondary causes of hypertension, where there are some medical conditions that will give you hypertension. And once that happens, those conditions, once they are treated, it means that your hypertension too is treated and is cured in a sense. Okay, so now with the risk factors that I mentioned, which together with your genetic or what you are born with, those risk factors, there are some that we can do something about it. Okay, they are environmental factors, you can do something about it. There are some that really you can't do much about it. And those that we can modify, we can do something about, are what we call the modifiables. Okay, and those that we can't do anything about it is the non-modifiable. And what are some of these modifiable risk factors? Okay, one of them is unhealthy diets. Okay, taking excess salt consumption predisposes you. It will not cause it, but it predisposes you to developing hypertension. And the daily allowed consumption of salt is about 5 grams per day for an adult, and that is equal to about 1 teaspoon. And you see, in our setting here, Ghana, it will be difficult for you to stick strictly to that. And one thing you can do is that whatever food you get, okay, try as much as possible not to add excess salt to it. Even if there's not much salt, you eat it, because you to be balanced with the kebab, the kobe, and all the other salted food that you'll be eating that you can't quantify how much salt is there. So try as much as possible not to add additional salt to whatever food you are given, because it will be compensated somewhere else. And then a diet that is high in saturated fat and trans fat, okay, that is those processed food, the pie, the donut, the cheese, the butter. Yes, those canned processed food mainly contain saturated and trans fats, and so they predispose you to having what we call atherosclerosis, where a lot of fat is deposited in the wall, okay, or within the walls of the blood vessel, and they become stiff, and so they can't even expand, and it predisposes you to having hypertension. And then low intake of fruit and vegetables. I don't know about Ghanaians. I mean, I think it's a culture thing. Most people don't like fruit and vegetable, but there are factors that predispose to that. But it's very important that we take fruit and vegetables every day, very important. Physical inactivity, yes, predisposes you to that, but you can do something about it. You can start exercising. And then consumption of tobacco. But I want to stress on secondhand smoking, where you are not the one smoking, but you are always in the midst of people who are smoking. Yours is even probably more dangerous, where you are taking in all the chemicals that is not filtered, and you are taking in that. It predisposes you to having hypertension as well. Excess consumption of alcohol, yes, predisposes you. Being overweight or obese is a predisposing factor, and insufficient sleep. Okay, insufficient sleep, short sleep during the night, having probably less than 7 hours per night. I'm sure a lot of people will be like, hey, then all of us will have hypertension, because I doubt a lot of adults in Ghana are able to sleep more than 7 hours. There's so much stress, work is demanding, we don't have much time, but we need to manage our time when to be able to have this at least 7 hours, 8 hours of sleep in the night, okay? Very important. Then we look at the non-modifiable factors, which are the family history of hypertension. You can't really do much about it. When you are growing, once you get to 65 and above, there's nothing you can do about it. You can't withhold your age. Or the other means is when you leave this world to the other world, but I'm not sure anybody will want to do that just to prevent hypertension, because hypertension itself may rather push you there anyway. So you can't really do much about it. And then coexisting diseases. When you have other diseases, you can't take them away unless those diseases are cured. Okay, but they can also be managed. Even though you can't do much about it, they can be managed properly. And then even though it is non-modifiable, there's something you can do about it. Now let's zoom into the secondary causes, hypertension that is as a result of other conditions, okay, medical condition or other circumstances. And I want to stress on these few ones that I've highlighted here, which I've highlighted here. Drugs, all right, drugs. A lot of people may not be aware of this, or may just, may not be aware of this, but some drugs, these are just but few of them. Chronic use of NSAIDs, painkiller, not all painkillers, but particularly NSAID, chronic use of them because of pain or for whatever reason, predisposes you to having hypertension, okay? Sodium containing antacid, you have a tummy upset, you have reflux, you are consuming antacids like no one's business, okay? And corticosteroid, I mean, people who use all those bleaching cream, people who take steroid for bodybuilding, people who take steroid for other medical conditions, it's a predisposing factor to having hypertension. Oral contraceptive, especially those that are high in estrogen. Okay, that doesn't mean that you shouldn't take oral contraceptive. I mean, you can, but those that are high in estrogen actually predispose you to having hypertension. It's not like taking in 1, 2, I mean, then you have hypertension, but prolonged take of this, okay, of oral contraceptive that have high estrogen predisposes you to that. And then illicit drugs like amphetamines, methamphetamines, cocaine, okay, also predisposes you to having that. Then I think I have the obstructive sleep apnea. Okay, sorry about that. Obstructive sleep apnea, very important cause of hypertension. And to put it in a simple way, people who snore a lot in the night may probably have this medical condition where we call it obstructive sleep apnea. But it doesn't mean that everybody that is snoring has obstructive sleep apnea. But if you find someone, a relative, a friend who snores a lot in the night, that it distracts almost everybody. Or the person, you've observed that once the person is snoring one way or the other, the person's breathing ceases for some minutes, and then it comes back. Or you realize that this person, during the course of the day, the person is sleeping most of the time because the person was snoring in the night or having restless night. The chances are that this person may probably have obstructive sleep apnea. It doesn't necessarily mean that the person have that. And so, I mean, it can be addressed in a hospital. That is also a predisposing factor to developing hypertension. Then we have some medical conditions. There are quite a number of them. I will not bore you with them, but I will just go through them quickly, like Cushing's syndrome, pheochromocytoma, primary aldosteronism, and other medical conditions like hypo or hyperthyroidism, hyperparathyroidism, and then some primary kidney disease. I mean, these are things we need to know. If we are not able to keep them in mind, I mean, it's not necessary. What I need the public to know is these ones in red, okay, that we usually ignore. Now, what are the symptoms of hypertension? Majority of people with hypertension will have no symptom. The symptom of hypertension is no symptom. That is a majority of people. So you can't say that, oh, me, I'm not feeling anything. I feel okay. I feel strong. And so I can't have hypertension. No, you will not have the symptoms. If you are lucky, you may probably have some early morning headaches. You may have some vision changes. You may have your vision being blurred. Oh, I wake up, I can't see properly. Or you may have some nose bleeding in the morning or during the course of the day. Or you may have some, you feel like your heart is not beating, or you feel the sensation of your heart. That is what we call palpitation. Or you have some ringing, buzzing sensation in your ears. Okay, you may have that if you are lucky. A majority, they will have no symptom. And if the hypertension is severe enough, it may actually cause nausea, vomiting, confusion, anxiety, chest pain, and give you some tremors. That is if it is severe enough. However, it doesn't mean that if you have all this, it means that you have severe hypertension. It may just be suggesting that the best way is to have it checked. Okay. Now, having it checked will lead us to making a diagnosis. And I mentioned earlier on in one of the slides where in measuring the blood pressure, it can be done under quite a number of conditions, several conditions. Okay, I mentioned it can be done, blood pressure can be checked in the office, that is in the hospital, or it can be done at home, or some devices can be applied on your arm. You walk through the day while the blood pressure is being checked. Okay, that is what you call the ambulatory blood pressure monitoring. And actually, this first one, ambulatory blood pressure monitoring, is the gold standard. But gold standard doesn't mean that that is what is practicable. In Ghana here, with most places, we may not have this blood pressure ambulatory BP monitoring. It's not available, or it's available in few places and it's a bit expensive for the average Ghanaian. So if that is not there, the best option, the other best option to use is to use the home blood pressure monitoring, where there are specific or there are instructions you need to get and measure your blood pressure in the house, or in the comfort of your room, in the comfort of your house, and whilst you are relaxed, okay? Then you measure the blood pressure. People say that when they get to the hospital, then their blood pressure goes up, and yes, it is true. It's possible that it can go up. However, it's also possible that the diagnosis of hypertension can also be made in the hospital. And that is what is usually done in most of the cases in our setting. It doesn't mean it is wrong. Yes, it can be, but the other two methods are much better way of assessing it. So yes, it can be done in the hospital as well. Now, in measuring the blood pressure, okay, there are do's and don'ts. I know there are quite a number of instruments or gadgets that we use, people have. People have the one that you tie on your arm, the ones you tie on your wrist, your ankle, your finger, and all kinds of things. But what is recommended is use the one that is tied around your arm, okay? And preferably use the digital one that is preferred. But just make sure that your battery is working well so that it doesn't give you wrong figures. Just make sure it's working well. Now, it's very important that we pay attention to these do's and don'ts. Very, very, very crucial, very important. Before the blood pressure is measured, make sure that you are relaxed. Sitting in a chair with arms supported. Probably you can rest it on the desk, maybe by you, or the armrest. You rest it on it, okay? With your feet on the floor. So if you are doing it and your feet are hanging in the air, that is not the best way to do it. And your back is supported for at least 5 minutes. And even if more, the better. But it's important that these things are observed in order to say that what you are measuring is correct. And then one needs to avoid caffeine, exercise, and smoking for at least 30 minutes before the measurement is done. Avoid talking during the rest period. Whilst you are resting, you need to avoid talking. And then during the time that the blood pressure is being measured, or the cuff is inflating or is tightening you, you also need to avoid talking. Then we need to remove any clothing that is on the location where the blood pressure will be measured. So if it's on your left or right arm, make sure you remove the clothing over there and apply the band or the cuff of the BP machine, which is a sphic, on your arm. okay, before it is done. Now, this other point, which a lot of people don't pay attention to, but it's important that if the blood pressure is being measured for the first time in your life, it's preferable to measure the blood pressure in both arms. And then the arm that has the higher blood pressure is used for subsequent blood pressure monitoring, because there are slight differences in the arm, slight differences. It doesn't mean that if it is not done that way, what you get is wrong. It doesn't mean that, but preferably this is the right way to go about it. This is the right way to go about it. And then, so if the blood pressure is measured and you need to repeat it again to compare, it's best to rest between 1 to 2 minutes. Between the two readings, you rest for 1 to 2 minutes before taking the next one. You don't take it now. In the next 10 seconds, you take it again. Another 10 seconds, you take it again. It puts your arm under stress. It puts yourself under stress. And stress can make the blood pressure go up. And then it's best not to use one single reading to make a diagnosis of hypertension. Even if it is high for the first time, don't use that to make a the diagnosis of hypertension. Even though I had mentioned earlier that few special times where one-time BP measurement could be used, but most of the time you need to use at least 2 or more readings, okay? And you do it under 2 occasions. So it can be done 1 today, you can do 1 tomorrow, do the other one the following day, or do 1 in the morning, do it in the morning, do the other one in the evening, and you find the average. And if it is high, then you can say that this person has hypertension. And obviously, the blood pressure needs to be recorded in the systolic and the diastolic, the upper and then the lower. Good. So we come to this table where we've talked about what the normal blood pressure is. We've talked about what hypertension is, or elevated blood pressure. What I want to highlight on this slide is this, the mid-range, okay? Between 130 and 139, and then for the systolic, and then 80 to 89 for the diastolic. This is what we refer to as the upper range of normal. You realize that I didn't include it in the normal, but it's upper range of normal. Now, this is where some people or some jurisdiction or some guideline in America, they'll diagnose all these people as having hypertension, and then you'll be treated. But in Europe, European Society of Cardiology, and what we adopt, like in Ghana, we tend to say, well, this is high normal, okay? It means that you need to start doing something. You need to start looking at the risk factors, especially the modifiable risk factor, and see whether there's something you can do about it, so that you don't progress to the grade 1 hypertension and subsequently to grade 3 hypertension. So you want to start doing something about it at this stage, okay? But there are some people who may have this, and based on other few conditions, we can say that, well, based on this, we think that you have hypertension and you are put on medication. It needs to be individualized, okay? But generally, we'll consider this as high normal and may not require treatment, okay? Now, after making the diagnosis of hypertension, how do we go about it? Investigate it. It is so important that once the hypertension is picked up, a professional sees you, okay, it's not just the BP is up, so let's put you on medication. No, it is important that you are reviewed or seen by a professional, where few questions will be asked, few examinations will be done, and then based on that, some investigations will be requested. And the aim of the investigations are, 1, is to identify whether you have some other condition that is actually causing the hypertension. In that case, if we find those causes and we treat it, it means that your hypertension, it's to some extent cured, or it's possibly can be cured. That is to find out whether you have things that are causing it. The second reason is to find out whether this hypertension that you've had has already caused damage, okay, in your system, in your organs, because you may have had it for several years, but you didn't know about it. By the time you come, so many things have happened, but you are not aware. But this investigation will pick up that, and then the treatment can be tailored towards you. And these are some of the investigations that we've been. We said that hypertension can affect the kidney. And so we need to check your kidney functions. We need to check your fasting glucose, okay? Diabetes and hypertension are bedmates. You may have hypertension over a period of time. It predisposes you to having diabetes, in the sense that people who have hypertension, one way or the other, they tend to have what you call insulin resistance. Insulin is just a molecule that helps to control your sugar. But people with hypertension tend to have some resistance. Insulin is not able to bring down the sugar. That is, you have insulin that is supposed to bring down the sugar, but there's some resistance to it. It's not able to work. So your sugars get a little bit high. That doesn't mean that hypertension will cause diabetes, but it's just a risk factor. It contributes to you developing diabetes, okay? And vice versa. Diabetes, when you have it, you may over time develop hypertension. And so they are bedmates. And so, well, we'll talk about the diabetes subsequently. Maybe the next, our next presentation, we'll talk about hypertension, and then we can marry the two and link it properly. Complete blood count, or what you call the full blood count, needs to be done. The thyroid stimulating hormone, that is checking for your thyroid, okay? Thyroid, one of the, especially in women or in female, thyroid needs to be checked. Now, I'm just mentioning thyroid because that is the simplest to do in terms of the various causes or medical causes that can lead to hypertension. There are several of them, of which labs can be done for it. And I must say that they are not that cheap. They are a bit expensive, but it is important that if it is suspected, we can't catch everyone and do all the tests for them. That is why it is important for you to see a professional, for you to be asked some few questions, examination to be done, and then it will be tailored that, well, it could possibly be this, and so let's investigate in that line, okay? So this is just one of them. There are several tests that can be done to pick up what is causing it, and then it can be treated, or you can be advised. Lipid, okay, your cholesterol level needs to be checked because it's also a predisposing factor. Then the ECG, some wires we put on your chest, electrode, to find out how your heart is beating, how it is functioning, because it can affect your heart as well, hypertension. So that needs to be done. Then importantly, this is what a lot of people don't get to know about, but it is important that the healthcare personnel or the professional calculate what we call a 10-year atherosclerotic cardiovascular disease risk. What it simply means is that you have hypertension. We know that it causes a lot of problems. One of it is that it may give you a heart attack. It may cause other cardiovascular, like stroke. It may give you kidney problem. You want to find out in the next 10 years, what is the probability that I will get a heart attack? What is the probability that I will get a stroke? That is what we are calculating over here. So based on that, and then it's graded. Well, it's graded. And based on that, things can be done to modify that risk, to reduce it. It may not eliminate it completely, but it will reduce it to the barest minimum. So it is important that we do this at the beginning so that we start monitoring the patient. This slide is very full, and it may be a bit advanced for the general public, but there are also other health professionals who are on this or may listen to this later on. And it's important we get understanding of this. What I will want to point out on this slide are just two. One, if you have here, and it is classified grade 1, grade 2, grade 3, you want to find out, or the health professional will want to find out, do you have any risk factor at all in you developing it? And if you have, how many risk factors do you have? Okay, and based on those risk factors and the grade of hypertension that you have, the risk of you having a stroke, the risk of you having ischemic heart disease in 10 years can be quantified as either low, moderate, or high, or even sometimes very high. In that case, your treatment needs to be tailored to your condition and not just being given medication to take. And so for the general public, if you go to the hospital with the diagnosis of hypertension, kindly ask, so doctor, what is the risk that in the next 10 years, I will get a stroke? Or what is the probability that I will have a heart attack? Once you do that, the doctor or the health professional is alerted to have this discussion with you. And therefore, your treatment can be tailored towards you, and not just that, oh, I'm taking medication for my hypertension. I'm taking medication. No, it's not just the medication. You need to be managed. You need to be treated as well. All right, thank you very much. Now, if you have, what are the complications of hypertension? If you have the hypertension, what will you do? I've already mentioned some of them. You may have a chest pain, you may have heart attack, you may actually have your heart failing. The way it's supposed to pump over time, it becomes weak, it can't pump again. You may have what you call the palpitations. You may have irregular heartbeat. The way your heart is beating, supposed to beat, but now it's beating all over. And if that happens, you may have sudden deaths. People sleep and then they may not wake up again. Or somebody you may see talking to, the next few minutes, they say the person is dead. Possibly, could this be that this person has an irregular heartbeat and had a sudden death? Yes, it's possible. Okay, now it may give you stroke as well as kidney failure. Okay, hypertension, it may give you that. Now, how do we prevent and control it? It's simple, but is probably difficult to do, and we need to be disciplined to do it. That is reducing salt intake, limited to 5 grams per day. That is about 1 teaspoon per day. Eating more fruit and vegetable. The year is beginning. Let's probably, if we've not made that New Year resolution yet, probably put in that this year I'll be eating more fruit and vegetable. If I can't take fruit and vegetable every day, then I'll take it every other day. Very important that we cultivate that habit. Being physically active, if you've not added it to your New Year resolution yet, probably you need to start doing that. Avoid use of tobacco. Those who are doing it, and make sure you avoid it, or if you can, reduce it, and over time you may be able to stop it. And most importantly, people who are always in the midst of people smoking, it's dangerous. Try as much as possible to avoid it, reducing your alcohol consumption, okay? Limit the intake of food high in saturated and trans fat. I've mentioned that already. Processed food, okay? Cheese, butter, pizza, donuts, pastries. Yes, those things contain a lot of that. Eliminating and reducing, okay, trans fat, I've mentioned that already. Now, we've gone through all this. If you have been diagnosed of having hypertension, how do we go about managing it? One of the most important things is to reduce and manage your stress. You need to assess yourself. Am I being under stress? Generally, I'm sure if they do a survey in Ghana, most people will be diagnosed as having hypertension because December, you spend all the money, Sekano, Ashe. Now in January, you need to go and pay fees for your children. And so you are thinking, where am I going to get money from? You're under stress, you are going to work, you need to work extra, and you're so much under stress. And so your blood pressure may actually go up. So once you are diagnosed with that thing, you need to reassess yourself and know how to reduce and manage your stress. Regular checking of your blood pressure, very important, because I mentioned that you may not have any symptom at all. Majority of people, no symptoms, okay? Treating the high blood pressure. Now, this is where medication comes in. Medication just form a little bit of it, okay? This is where, and there are several classes of medication that you need, that one can take, okay? And some people may be on 1 medication, others may be on 2 medications, others may be on 6 medications. If you're on 6 medication, it doesn't mean that, hey, your hypertension is so bad. People may just, we are all different, and the way our system responds to medication and treatment is completely different. So when you have hypertension, you are being put on 1 and it controls, it's fine. If somebody is on 2 or 3, it doesn't mean that theirs is worse than yours. Okay, it just, that is what is needed to control it. And then you need to manage other medical conditions. So this discussion, we need to know about it. And then when we see the professional, we have all this discussion with them, conditions like diabetes, lipid level or cholesterol, and then pain, joint pain, because that is what will push people to go and get the NSAIDs, okay? And which may further worsen the hypertension. And then there are other conditions that need to be treated as well. Now, very importantly, I would like to address some myths about hypertension. In our next 3 slides, we'll address that, and then possibly we'll be coming to the end of the presentation. So the first one is that my high blood pressure isn't that bad because I don't feel sick. And people have said this to me over and over. And I said, majority will not have the symptoms. And so the sure way, the fact that you are not sick doesn't mean that you can't have hypertension. You need to check to be able to diagnose it. And then people who have active lifestyle, low body weight, and healthy diet do not need to worry about high blood pressure. If you have active lifestyle, you have low body weight, and you are eating well, that is so good, fantastic. But it doesn't mean that you cannot have hypertension, because I mentioned at the earlier that you may have genetic makeup, things that you are born with, and when they interact with the environment, okay, then you can develop hypertension. There are people who are so slim that even when the wind blows, it may blow them away, but they have hypertension. It's because their genetic makeup or what they are born with is so strong. And so the only sure way is for the blood pressure to be monitored and measured. That is the only way you can pick it up. So let's take note of that as well. Now, others may say that my high blood pressure is just part of getting old. I'm old and my blood pressure too has gone up. And so it is not normal that even though it's a normal procedure or it's a normal process, it is still not normal. If it is high, it has problem for you. It has problem for the system. And so it needs to be brought under control. Then some will say that I changed my diet and started to exercise, and my high blood pressure went away. Very interesting. I don't have to worry about it anymore. Fantastic. You started doing the right things, the correct things, exercising, eating well, going to the gym, and your blood pressure is under control. It is very important that you maintain that. And whilst maintaining that, it's important that you regularly check your blood pressure. Yes, it may be that once you're doing that, your blood pressure comes down. You may not need to be on the medication. For example, those that I've said are high normal, okay? This is where you need to exercise and it comes to normal. It doesn't mean that you shouldn't do anything about it. It means that you need to continue those activities and then regularly check your blood pressure, because that's the sure way to be able to pick it up. And then one will say that I started taking high blood pressure medication and now my blood pressure is normal. So I don't need the medication anymore. And I see this over and over, plenty. Some people, they don't feel sick or because I've taken it, oh, my blood pressure is now okay, so now I can stop. Immediately you stop, the blood pressure will start going up again. And so it's important that we continue the medication until the time where you are told that, well, you may not need the medication again, even though that doesn't happen often. It doesn't happen often at all. Now, there's some may also say, now that I have high blood pressure, there's nothing I can do about it. Some have taken it, well, it's part of me. What should I do? I'm not feeling sick, so why should I worry about it? But it's important that we treat it, because if you don't, then over time, you will develop those heart stroke, you may develop that heart attack, you may have your kidneys damaged, and you'll be surprised why this happened. And you may think that, oh, it's somebody, some witch somewhere, or some spiritual forces somewhere that are against it. No. It probably could just be because of this. Now, cutting out salt can eliminate high blood pressure. I think we've addressed this to some extent. Yes, It will not eliminate, it will reduce the risk of you developing it, or it may bring it down. If you're taking medication, it may make it that your blood pressure now is very controlled on the medication that you are having. Now, antihypertensive drug cause sexual weakness, so I will not take it. These are some of the things that people have actually said, because it causes sexual weakness, so I will not take it. And I've had very embarrassing experience with this, with some of my clients, where there was an incident of, I think 63-year-old male had difficult to control blood pressure. And this man will not take the medication. And we spoke, we advised, did whatever that we did. And he just told us point blank, if he will have sexual weakness, then he prefers to die. And that tells you the importance that people place on their sexuality, especially my fellow men. Okay, and so they will not want to take the medication, and they'll prefer to die rather than have sexual weakness. With the women, well, they may have what we call reduced libido, but that is not very common. That is not common at all. And all the antihypertensive medication, they do not have some have more effect or cause more sexual weakness than others. And there are some that are minimal, negligible. Okay, so those ones can be given. And even if you develop it, there's a way to go about it. It's better to take it and have your blood pressure control. But well, some may prefer to die than have the down there die. Okay, so I mean, we can just continue advising people. Can hypertension medication be combined with other medication? Yes, it can. Just be sure that discuss with a health professional, because some medication may actually counteract or negate the effect of the antihypertensive. We are trying to bring the hypertension down, but the medication that you're taking will be bringing the blood pressure up. So there are a whole lot of medication that can do that. It just needs to be, you have that interaction with your doctor or your health professional. And then, is hypertension curable? This is a very important question that people keep asking. And unfortunately, some in the system or in the space will promise you heaven on earth that yes, your hypertension will give you medication, it will cure it. And most of the time, I have my reservation, but how I'll answer this, it's a yes and no. What we know is that if you have hypertension that we can clearly identify what is causing it, then we can say that once we treat those conditions, you are cured. There are most of the time, you will not be able to cure it, especially those with essential hypertension. You may not be able to cure it. However, you may be able to do things in the right way to bring it under control. And that is the most important thing. The fact that it's under control doesn't mean that you shouldn't, it means that you are cured. It means that whatever you're doing to bring it under control, you need to do that. If it is medication, you need to continue. If it is exercise, if it is dieting, if it is eating the right way, you need to continue that to bring it, to maintain it down. And we can't say that it is cured, but it can be managed or brought down significantly. All right, so in summary, we've been talking about hypertension as an elevated blood pressure, which affects several organs in the body, okay? And the incidence is increasing. A lot of people are not aware at all. And even those that are aware, just a handful are medication and having it controlled. Largely, it is interplay or interaction between what you are born with, your family history, and what you interact with in the environment, okay, such as physical inactivity. Here I wrote physical activity, but it's physical inactivity, obesity, alcohol, and tobacco. I mean, these are some of the things that when we interact with, predispose you to having hypertension. Majority of people will not have any symptom. The symptom of hypertension is no symptom. But if you are lucky, you may have headache, blurred vision, awareness of your heartbeat, as palpitation, okay? Prevention and control is key, very important. Very important. However, if you are diagnosed with it, I mean, there's treatment for you, even though we will not prefer cure, but you usually will have to take the medication for a long period of time. You may probably just get cure for those that we can identify exactly what is causing it, and then we treat those ones. And so thank you very much for the audience. I know I've taken a lot of time in explaining. We'll hand over now to Albert, and then we can begin the discussion. Thank you very much.
Thank you very much, Dr. Daniel Amono. This has been an extensive expose on hypertension. It has become very needful because, like you rightly said, only about 50% of people who have hypertension know they have. And even those who know they have, only a handful of them are on medications. And even those who are on medications, only a handful have it under control. So it's very important for people to know. And I'm glad you actually talked about the issue of erectile dysfunction. You know, most men have had such experiences before. So what I will also say is that when you have erectile dysfunction whilst on medication, always speak to your doctor. Don't just stop medication. Now, there was a question on YouTube by one Madam Rita Sarkodia. She says that she knows that hypertension is more common in males because in females, the estrogen is protective. However, you said that oral contraceptive pills predisposes to hypertension. She wants to reconcile these two statements. If you can handle that for her, please. In the meantime, those who have questions, please put in the chat box or in the comment section, and Dr. Daniel will help us handle all.
Albert, please, can you hear me?
Yeah.
Okay, so I mean, yes, estrogen, it's hypertension here is more common in males than female. And we said estrogen is, yes, to some extent protective, but once you pass menopause, I mean, you are more like a male, your estrogen level comes down. But what we are saying is it's a bit tricky. What we are saying is contraceptive pills that are high in estrogen. Your normal estrogen that you have females, I mean, that is okay, but when excess of it gets into your system, one way or the other, it will predispose you to having hypertension. One would have thought that, well, if estrogen in female is protecting, then let me take some, let me take more and get protected. But it is not that linear. Realize that if you actually have it more than certain level, it is actually detrimental, and you rather develop hypertension. So that is how it is.
All right, thank you. Now I have a question for myself. You said we should use the digital BP monitoring machines compared to the sphygmomanometer. How do we reconcile? Which one is preferred, the sphig or the digital BP monitoring machine?
What is recommended is to use the digital and get one that is working correctly. However, you know that these are machines and are bound to have some errors, especially if you're not sure that if you can't vouch the accuracy of the machine. And sometimes they call something, the machine needs to be calibrated from time to time. Just make sure that your batteries are working well. Sometimes you may have some discrepancies where you may have to get the manual one, okay, to verify or to confirm it, but for ease use, okay, for the ease with which it can be used, and then the reproducibility, that is, if you measure it now and you measure it the other time, the difference will not be much. And then interpersonal variation, the manual one, person A will measure it and give you a different value. Person B will give you a different value. Person C will give you a different. But if you use the digital, it's likely to give you some consistency amid some little variation. So that is what is recommended, actually.
Yes, it's very clear. Thank you for the education, especially the interpersonal variations and the reproducibility. Yes, thank you very much. Someone is asking, Doc, can high blood pressure cause internal bleeding?
I hear this a lot. When they say internal bleeding, well, I don't know what that person means, but yes, you could have internal bleeding in your brain, you could have bleeding in your heart, any bleeding that is within, I mean, that is it. Yes, so if you have a stroke, for instance, you can call it internal bleeding because stroke, I mean, a specific type of stroke, hemorrhagic stroke, where the blood vessel, there's so much pressure in it that it bursts, just like a normal water hose, where the pressure sometimes when it's too high, it bursts. So the same thing can happen in your brain and you're bleeding, or in your chest, in your stomach, where the big artery over there, which you call the aorta. Now, if the pressure within it is too big, obviously, yeah, it can burst. And also you may have bleeding into your abdomen, or you may have bleeding into your chest, but that doesn't happen very often. But yes, it is possible. Just to address what the person is talking about, internal bleeding. That is, I'm assuming this is what the person means by internal bleeding. But if the person, if I haven't answered and want to make it clear what he or she means by internal bleeding, I'll be very happy to address that.
All right, thank you very much. Just to go back a little, you said the digital BP monitoring machine should be calibrated. How do we do that? If you go to the shop, medical equipment shop to buy, how do you make sure this particular one is well calibrated?
No, well, it will be difficult to determine that. Just get a recommended one that is recommended. I will not be able to recommend any particular one for you now because I don't have that. I don't have that license to do that. But once you're getting it from a reputable company, or you can actually search on the net as well for digital speak that are recommended, that are known. If you see me personally, I could probably recommend some that I think are good that you can use. But in calibrating it, it will be difficult for any individual to do. There are specialized people who do that.
All right. Okay, so if you have any question, please feel free to put in the comment section in the chat box, and Dr. Danny will handle it for us. Again, somebody wants to know, how do you know if an oral contraceptive has higher doses of estrogen?
You need to ask. You need to ask.
Yeah. All right. Okay, so in my personal practice, when I see some people with a high blood pressure who are on medication, some of them still struggle with good control, I recommend some supplements for them, notable among them LGBT or 357 and those. Is it advisable, from the expert yourself, is it advisable to take supplements alongside your prescribed medications, please?
Well, this is how I'm going to address it. Taking supplement is not bad, okay, because it boosts the immune system. And what I have had some experience with the supplement you've mentioned as well. But if somebody doesn't have the blood pressure that is under control, one of the first thing I will want to recommend, one, is the person compliant to the medication? That is one. Two, is the person able to address some of the modifiable factors that need to be addressed? And once I'm sure that the person is doing all those things, there's no problem recommending supplement in addition, okay, recommending to be added, and I'll stress to be added to the hypertensive medication, because it will not only help in bringing down the blood pressure, but it may help in strengthening your immune system as well. So you don't take that in place of the anti or the hypertensive drug. So yes, I would say it can be taken together.
Yes, so just for people to be clear, it is a supplement. Yeah. It is not a drug to replace your antihypertensives. It works with your system to make you stronger, so that when you take your BP medications, it works perfect. What I normally recommend is LGBT, sometimes max 357, because of the omega-3, which is cardioprotective. So yes, it's a supplement. It's good, FDA approved, just like you take it alongside your BP medication. Now, my question again is, people who have hypertension, are they going to be sentenced to a lifelong medication?
Okay, so I think I try addressing it. It's yes and no. Most of the time, if If the cause like is secondary to something, it is because of this underlying condition, then I will say no. Because if those conditions are treated, then your hypertension is cured. But where you have a very strong family history, and because of some other environmental factor, you develop hypertension, most of the time, I'm stressing most of the time, you will have to be on the medication for life. However, there are few and packets of cases where when you are in touch with a professional, with your doctor, when your blood pressure is controlled and you realize that sometimes you are just on very minimal one, and sometimes your blood pressure is even very, very low, probably because you are doing the very right things, exercising, eating more fruits, reducing salt intake, reducing your saturated fat, losing weight, you are doing those things. Maybe the blood pressure has come down. You need to maintain that. And then in consultation with your doctor or your professional, you may be asked to withhold the medication for sometimes while the BP is being monitored. But no, under no circumstance should one just decide that, oh, my blood pressure is okay, I'm stopping my hypertension. That is very dangerous to do. And so that's why I'm saying that most of the time, you may have to be on a medication for life. Hello, Albert, please, can you hear me?
Yeah, per what you just said, will I be right if I say that you can be diagnosed hypertensive, but if it is well controlled, you can be taking off medications whilst your BP is being monitored regularly? True or false?
Yeah, they can. Yes, that's true.
Okay,
that's true.
So the aim of compliance is to get it to be well controlled so that we can reduce the dose and number of medications, possibly to a place where we may have to take you off whilst monitoring your blood pressure. Thank you. All right. Now, somebody also wants to know, does high blood pressure cause high body temperature?
Under normal circumstances, no, it's not. It doesn't cause high body temperature. No, it's just pressure that is exerted on the wall. It doesn't lead to your temperature being high. If your temperature is high, it could also be because of some underlying condition, something that may be related to your thyroid, because sometimes we call hyperthyroidism. A lot of your thyroid hormone has been produced, okay? And that thyroid hormone can actually make your body hot. And so people are feeling, what's the name, cold, but you are feeling just hot. It probably just means that you may have an underlying problem that is causing the hypertension. And it is not the hypertension that is causing your temperature to be hot. I hope I've been able to address that.
Yes, thank you very much. If any of you have any question, please drop it in the comment section in the chat box, and Dr. Dani will handle it for us. We have a few more seconds to go. Ask any questions that you might have, anything you want clarified. What's an extensive education on hypertension? You will not get it anywhere that easily like that, where you have a specialist dedicating time to take you through a particular medical condition. This is very common. A lot of people die from it suddenly. And we are having this to help reduce the level of, misinformation out there, especially on social media. And we are grateful to Dr. Dan. Like I told you earlier, we had to travel to a place where it was possible for him to reach us. So there will not be any interruption. If you have any question, please drop it in the chat box right now in the comment section, and he will gladly help us answer them all. We have a few seconds to go, so if you have any questions. Okay, there's a question here. If the person takes his or her meds, can the person still have stroke?
Okay, very, very, I think I like this person, the person who liked this, who asked this question. So the aim of you taking medication is not just for you to take medication. The aim is to bring the blood pressure down. And so I made a point in the second slide that most people, if you take 5 people who are taking BP medication, it's only one that will have the BP that is under control. but 4 of them will have the BP still high, and such people can still have the stroke. So if you can still have a stroke, that is if you are taking medication and you are not having your blood pressure checked and say that, oh, me, I'm taking my medication, I'm taking my medication. They've given you 4 medication to take, and you are so religious with one, that the rest 3, you are not religious with it. As and when you feel, you take it. You are not monitoring your BP. You can still get a stroke. You can still get a heart attack if the blood pressure is not controlled. And even if the blood pressure is controlled, there are few other risk factors that could make you get stroke, heart attack. Those other condition risk factors also need to be monitored, especially if you have lipid problem with your lipid, if you have diabetes. Those conditions also need to be very, very controlled, because even though you may have your BP that is well controlled, if those are also not controlled, you can still have a stroke.
That was a brilliant question, and of course a brilliant response. Yeah, so it's not, you're not just taking medication for taking sake. You are taking it together with monitoring your BP to be sure it is well controlled, so that they know how much of what to give you to prevent the stroke. So don't just be taking the medications blindly. Know whether the medications are enough or not. Thank you very much, Dr. Danny. Another question, and that will, I'm sure it's been already answered, but it's been asked on YouTube. What is your advice to a 31-year-old who is on amlodipine with an average BP of 140/90? What will you, as an expert, tell such a person?
It would be good to have known whether this person is a male or female, but that opportunity is not there to be able to give very specific answers. But I'll just give a general answer. This is somebody who is 35, right?
Yeah, 31.
So that will be considered somebody who is young. Anybody under the age of 50, okay, who develops hypertension, you need to examine this patient critically, i.e., you need to take a very detailed examination. You need to examine this person to be able to find out whether this person has any underlying condition, because it is, in quote, not normal for such a young person to have hypertension. It could possibly be that this person has other medical conditions, and those medical conditions need to be treated. One of the things I find most of the time is, even though hypertension is common, people don't really appreciate that it takes some resources to be able to investigate, to find out whether they have other conditions. And most of the time it is expensive. And sometimes I ask myself, you do all the tests and nothing comes out, it is negative. And then the patient will ask you, so why did I do it? Why did I do it? Because it's expensive. Because it is important that you find that you don't have it, because once you have it, then it can be treated, and then your condition is cured, in quote. Okay, so that person needs to be reviewed by a professional to find out whether they are underlying condition. And those investigating, it doesn't come cheap, unfortunately.
So he said he's a male. It's a male he's referring to, a male 31-year-old on amlodipine, okay. Average BP 140/90. Okay,
so yes, definitely that person's BP need to be assessed. I mean, to find out why is it so. Okay, is the person slim? Is the person obese? If it's obese, probably that's a risk factor. Help you reduce your weight. Inactivity, you need to start going to the gym. If you are not eating food, your cholesterol, all those things need to be added. But more important, whether you have any hidden medical condition that can be treated. But once you are on amlodipine 10, the other one, before any addition is done, okay, you need before any addition is done, you need to find out, one, is this person compliant to the medication? The medication you are taking, is he a fake one? Because there are other things in the system. Is he a fake one? Second, the third thing is whether you are taking any medication that is actually counteracting the effects of amlodipine before I will add on a new medication to it for you. Okay, and so, I mean, there are other, amlodipine is one, there are other classes of medication that can be added. And then I'll add quickly that it doesn't mean that you should stop the amlodipine. and go and take a different one. That is what some people do. That, oh, this medication hasn't brought it down. It means that it's not good. And so then they go and change it to another medication. Oh, it hasn't brought it down. It means that it is not good. Then they go to the next one. But it is not like that. Amlodipine is actually a very good medication for treating hypertension. So if it is not being controlled, he can assess to see the things that I have mentioned about compliance, about any confounders, and then if not, an additional medication can be added. And sometimes this additional medication, there are combination medication that are available where it can combine amlodipine with another medication, but you take it as just one tablet. But the only downside to it is that most of the time, those medications are a bit expensive. Otherwise, you may have to take amlodipine different, and then the other medication are different. I'm being careful not to mention it, any other medication, because then people will just want to go and buy it and add and not know the rationale behind it. And it may cause more problem than good. All right, thank you very much.
All right, so Godwin, on YouTube, you just had a free specialist consultation. You now know what to do. Such a young person shouldn't have high blood pressure uncontrolled. The person needs to find out what are the things that is making it like that. Whatever has to be done, you need to go see a professional. We have a few seconds more to go. If you have any question, please drop in the chat box. Somebody said, Docs, thanks for the education. Please, are you into private practice and how can I get in touch with you? Yes, so Jifa, I'll get you Dr. Danny's number. Just look through my YouTube link and send me hi or WhatsApp. I'll link you directly to Dr. Danny. All right, Jifa, look through my YouTube link, Dr. Wasedo here on YouTube. My number is there. I'll link you to Dr. Danny. Yes, he's into private practice. He's a young man. He's hardworking. Yes, he's into private practice. All right. So any more questions? Any more questions? Any more questions? A few seconds to go. Yes, it's been an extensive expose on hypertension. The good thing here is next week, Dr. Danny is going to avail himself again, and we're going to deal extensively again on the twin brother of hypertension, that is diabetes. So next week, we're going to deal extensively on diabetes, yes, or extensively, just like he did for the hypertension. So few seconds to go. If you have any questions, please put in the chat box. Put in the chat box, put in the chat. If you have any questions, please put in the chat so that we can now allow Dr. Danny to, rest. He's done a yeoman's job. Thank you very much, Dr. Danny, for the extensive expose. All right, thank you very much. All right, so without much ado, I just want to say, everyone, please join me. Say a special thank you to our guest speakers, Dr. Daniel Amewonu, specialist physician, Kolibu Teaching Hospital, who's availed himself for the last 1 hour, taking us through all we need to know about hypertension and how to go about. I was impressed with where he made it clear that investigating hypertension is very expensive, but has to be done so that you can have appropriate treatment. And of course, we need to know that a lot of people don't even know they have high blood pressure. And if you have any concerns with regard to your medication that has been prescribed you, don't stop. Danny, my final question before you go. What is your take on people saying herbals can be used to treat hypertension? That's my last question.
Okay, Albert, thank you very much for the question. And unfortunately, that's what I was referring to as in this space of health delivery. We rather find people promising heaven and earth that they'll cure your hypertension. So when you come to me, I am the last stop. If you don't get it treated, forget it. And they use all kinds of medication. I am a believer in herbal medication. I don't downplay it, in as much as I think that it may have a role. But what is unknown to us is that, see, most of these herbal medication also contain other chemicals or other properties that over time cause more damage than good. And they have a lot of effect on our kidneys that you may not see today, you may not see tomorrow. It takes time, it takes years for it to manifest. And so you see very young people developing kidney problem and so developing kidney problem, and you wonder why, or people are hypertensive and then they are taking herbal medication, and unfortunately, once they are taking that, they are not having their blood pressure checked, and because the symptom of hypertension is no symptom, they feel they are fine, and so then they come down with what we don't want, and so it is something that I don't advise for my patients. I will not advise that for my patient, okay? In as much as I don't think that herbal medications don't work, they have more damaging effect than good, at least for now. That is what we know.
All right, let me put the devil's advocate once again. So there are people who deceive people when they want to sell them herbal preparations for, in quotes, their supposed cure. They tell you that the prescribed medications cause long-term organ failure. Please, what is your response to that?
As in the medication that are prescribed in the hospital?
Yes, they tell them the medications will end up damaging your organs in the long run.
Okay, I think Albert, thank you very much for raising that. It nearly escaped me. I think I wanted to address that. See, any medication that we take in this world has side effect. Food is medication. Food has side effect. If you don't swallow well, it will choke you. Go and take, be eating fish and don't eat it properly. The fish bone could be trapped in there. It has side effect. Even paracetamol has side effect. But what you ask yourself is the benefit against the demerit or the side effect. We always weigh it. And if you realize that the benefit outweighs the damage that will be caused, then it's better you take it. Because even paracetamol has side effect. And I'm just telling you, somebody will also say that then the herbal medication also has side effect, and therefore they will weigh it. But the thing, what we have noticed and seen is what I'm telling you. Herbal medication, once you are doing that, if you can be sure that when you are taking it, your blood pressure is controlled, then so be it for you. But I will not advise any of my patients, any of my clients to take herbal medication and stop the orthodox medication. I will not do that. But if that is working for you, continue. But I will probably advise you to stop. Or once you're on that, please be checking your kidney function, because that is where it causes most of the problem. Be checking it. Be checking it. All right. Thank you.
Danny, I think you are being conservative. You're just being too careful. The herbals don't work, period. It affects your liver and your kidneys in the long run. It doesn't work.
Well, that is not me. I mean, we all have opinions anyway. So.
Okay. All right, so guys, it's been an extensive expose on hypertension. We've learned a lot. I've learned a lot. Be refreshed. Thank you very much, Dr. Daniela Monu. Yes, he's into private practice. Those who want to link up, please send me hi. I'll link you to him. And thank you very much for all of you for making time to join us. Please feel free, when the recording is shared, to share with your friends who may or may not have, or just for education purposes, so that we can reach more people. If you are yet to subscribe to my YouTube channel, or the friends that you have are yet to subscribe to the channel, please, we are growing. The channel is growing, so feel free, click on the link, just 2 seconds, click on the link and subscribe, put the notifications button on, so that anytime we go live, you will be notified. Next week, Dr. Danny has made it clear to me that he will be available again for us to go deep into the twin brother or the twin sister of hypertension, that is diabetes. So please stay tuned, put a notification button on, alert your friends so that we all learn again next week. So once again, Dr. Danny, thank you very much. Well done. We appreciate your time. Once again, it's been a pleasing pleasure serving you all. Enjoy your day.
Okay, thank you very much, Albert, and then to your audience as well.